What if I told you that millions of people are spending nearly half of their lives connected to a machine just to stay alive? And that scientists have built something small enough to wear on your waist that could quietly clean your blood while you work, or even sleep. This is not a science fiction. This is wearable artificial kidney. A device that could transform how we treat chronic kidney diseases. But who invented it? Where is it being built? And most importantly, how close are we to seeing it in the real life hospitals in India? Chronic kidney disease or CKD is rising globally and in India, largely because of increasing diabetics and hypertension. When kidney fail, patient needs dialysis or a kidney transplant to survive. Most depend on hemodialysis, 4 hours per session, 3 times a week, every single week. That means hospital visits, strict diets, limited travel, financial pressure, and constant fatigue. Dialysis saves lives, but it also limits freedom. And this is exactly where researchers began asking, what if dialysis didn't require a hospital at all? The modern concept of wearable artificial kidney, often called WORK, was developed by Dr. Victor Gora, a nephrologist based in Los Angeles, United States. He and his team worked on shrinking the traditional dialysis system into a compact, belt-like device that patients could wear. The early prototypes were tested in small human trials under regulatory supervision in the United States. These studies showed that continuous dialysis through a wearable system was technically possible. That moment was historic because for the first time, dialysis was not confined to a giant hospital machine. Most of the active development of wearable artificial kidney technology is happening in the United States, particularly through research collaborations involving the universities, medical centers, and biomedical engineering teams. Institutions in California and Washington State have conducted early feasibility trials. In parallel, global kidney innovation programs are supporting research in portable dialysis systems, including wearable hemodialysis and wearable peritoneal dialysis concepts. The technology is still primary in advanced research and clinical development phases, not commercial mass production. Here's the simple explanation. Traditional dialysis machines use large volume of purified water to filter the toxins from the blood. The wearable artificial kidney instead uses the sorbent technology. Sorbent cartridge clean and regenerate a small amount of dialysate fluid repeatedly, allowing the continuous blood filtration without needing huge water supplies. The device includes miniature pumps, filters, and rechargeable batteries. Because it works more continuously rather than in a larger intermittent sessions, researchers believe it may reduce the sudden fluid shifts and blood pressure instability that patients experience during the standard dialysis. Now here's the important reality check. The wearable artificial kidney is still in the experimental and clinical trial stage. Early human studies have tested short-term use, ranging from several hours to about a day, demonstrating that the device can filter the blood safely under monitored conditions. However, long-term large-scale trials are still required. Engineers are refining the battery life, clot prevention systems, safety alarms, and device durability. Regulatory approval requires strong evidence of long-term safety, effectiveness, and quality of life improvement before it can become standard dialysis alternative. For India, where the CKD cases are rising and dialysis access varies between urban and rural regions, a safe and affordable wearable dialysis system could significantly reduce the hospital burden and patient travel time. But affordability, public health integration, and government policy will determine whether this becomes accessible innovation or remains a premium technology limited to a few. Imagine gaining back 12 hours every week. Imagine not planning your life around a dialysis schedule. The wearable artificial kidney represents hope grounded in science. Not hype, not miracles, but careful clinical progress. And if you want more evidence-based stories about medical breakthroughs that could reshape India's future, please subscribe.